For this portion, I'm gonna put the questions to the group, and whichever of the presenters are inclined to answer, they are welcome to kind of jump in, pass it back and forth, and if anyone says anything that anyone else would like to also comment on briefly, please feel free to do so. Let's see, there's one question, and I think this was something that came up in Alec's talk, but anyone could respond to it. Could you please say more about the difference between validation and praise that you mentioned?
Well, it's funny. I was going to actually comment on the question that Carla was talking about earlier between mentalizing and validation. And again, I am no expert in mentalizing. I literally just had a 2-day course. But my sense about mentalizing and validation is that for the DBT therapists in the room, level 1 validation is kind of listening with a kind of beginner's mind and kind of in so doing asking clarifying questions to better understand what that individual's experiences, thoughts, feelings, and so on. So there's a level 1 kind of validation for sure. Level 2 validation in DBT is kind of accurate reflection. So you're saying this, and do I understand that correctly, right? And level 3 validation is this idea of mind reading, which is kind of verbalizing unverbalized experience of the client. So, I mean, in terms of mentalizing and validation in DBT style, my sense would be there's the overlap between at least levels 1 and 2. Then when you get into level 4 and 5 DBT validation, level 4 validation is based on your past experience. And, you know, it makes sense why you're having difficulty now, right? Based on your past history of trauma or abuse with so-and-so, it makes it hard to sit in a closed office with a male therapist, for example. And level 5 validation is, it makes sense based, anybody would have the reaction you're having right now based on normative functioning. So there's different levels of validation, and I think the greatest overlap between mentalizing and DBT, in my initial thought about it, is levels 1 and 2.
What about mind reading?
And then 3, I guess I'm interested to hear Carla in terms of mentalizing. Would you kind of hazard a guess? I'm wondering if you're feeling angry.
Absolutely. Absolutely, I do think you know, that would still count as mentalization when you feel you can
talking to the mic a little bit.
You can guess what the person might be thinking, but you will start off with a level 1 and a level 2, and then move to a level 3.
Yes.
Yeah, I think that's very helpful. Thank you.
Mm-hmm. And in terms of the difference between validation and reinforcement, they're two completely different things, because validation is acceptance. There is absolutely, you know, no approval necessarily there. For example, if you're saying, you know what, gosh, I totally understand why you cut yourself. You know what, in the past when you cut, it just gave you that release and you just felt better in the moment. Of course you'll continue cut if you had that. In anything that I say, was there an approval? Like, continue cutting, great job? Absolutely not. So validation is acceptance, reinforcement is approval.
And that, again, you're saying reinforcement, that notion that if someone is using praise, believing that trying to do validation but doing praise, that they might be trying to do reinforcement.
And that is, exactly. That's one of the things that trips parents and trips even providers in terms of being afraid to validate, because they're afraid that they're going to somehow reinforce, you know, whatever negative behavior that's happening.
But you could say, I really noticed you put a lot of effort into that, and validate their effort and behavior, and in so doing, it feels like reinforcement. It feels like praise. Like I'm validating, acknowledging that effort. So there's some times where it can have a duplicative effect. Would you agree?
Not necessarily.
Let's do it.
Can you please say it again?
So let's say my son was having trouble with baseball, and he finally gets out there and kind of practices, and he puts some effort into his practice, and I say, you know, wow, I really noticed you put a lot of effort into your baseball practicing today. Mm-hmm. So I'm validating his effort, not necessarily, not that he performed well, not that, you know, but I'm validating effort. So a behavior. Yes, I do want it to increase.
Right, but this is something that you're reinforcing in the moment. Mm-hmm. Right? I'm seeing that you're putting a lot of effort into this. You know, I'm not necessarily saying great job with that.
Yeah.
Right.
I'm reinforcing, I guess I would say, and I'm acknowledging his his behavior. I'm acknowledging it as it is. And so I think that's an example to me where it could be both.
Right, right. Well, validation in its most core is understanding. Usually validation is about, something that we suffer about. And, well, usually it can actually be a lot of things, in terms of what we are usually doing is we're validating the piece there the patient is suffering about. It can, of course, be something else. I understand how happy you can be about this, right? But this is not something that is necessarily what our core methods are.
Before moving further in or moving on, could we clarify, Alec, you had said that teachers will do praise thinking they're validating. Could you give an example of that, of like a praise that's clearly not a validation, it's a praise?
It's like, you can do this. Now, at some level, fundamentally, I'm validating my belief, I'm validating the belief that you're capable, right? But it's more, they're doing it more like a cheerleading encouragement, and like, oh, I'm so bad at math. Oh, you can do it. You can do it.
And that's not validating.
No, it is. Cheerleading is validation level. Cheerleading is validation level 7.
But the kid gets more dysregulated. I would say if the kid's getting more dysregulated, it's not experienced as validating, even though cheerleading could be considered that, if that's their go-to, and they're not acknowledging the kids saying, I know you feel like math is really hard.
Oh, absolutely, right. Absolutely. If you may indeed invalidate in the moment. Yes. Absolutely.
Right. Okay.
Right.
I'm going to open it up to a next question. There was a question about mechanisms of change, and I'm wondering if from the different orientations we've heard about mentalization, DBT, if we look at behavioral outcome, to what extent do we have evidence that treating the hypermentalizing or reflective functioning, or in DBT, that the things that we think we're doing actually are mechanisms of change? What evidence do we have evidence of that?
I can go first. I do think in general intervention research has suffered from not looking at mechanisms of change adequately, and I would say for the last 5 years perhaps there's been a new interest in that. And so in the RCT that Bateman and Fonagy did in 2008 in adults, they didn't really assess mechanisms of change explicitly. In the RCT that Trudy Rousseau and Peter Fonagy did for the adolescents, they did actually include a mentalization questionnaire. I wouldn't say it was the best one that you could possibly do, but at that time, say they started the study in 2009, 2010, there wasn't really much out there. But they did show that it was a reduction in that mentalization that was associated with the reduction in self-harm behavior and then borderline symptoms. But I think generally we're poor at doing that, and we need to include that more in our research.
Okay, and on that note, we are going to say thank you very much, Dr. Sharp. We're so glad you were with us.
Thank you, Carla.
Bye.
On the DBT side of things, Marsha Linehan developed a ways of coping checklist, which is a list of kind of skillful ways of coping with things, and I think she's published a number of papers demonstrating the effectiveness of some of these DBT skills on its effect on emotion dysregulation and improved outcomes in other areas. But as Carla suggests, I think there's a lot more room for improvement with instrumentation and better analyses.
Okay, and we have a question here about helping parents with extinction and having it not lead to reinforcing escalations of behavior during what's called a behavioral burst that they mention. And I want to invite this. I think in addition to our treatment experts, in terms of suggestions of getting through the behavioral burst, if Allison has anything to comment on not getting going through a treatment where people are trying to respond to you when things come up, getting through that without it leading to kind of worse behaviors, if that makes sense, and only if you're comfortable. So again, so it's really about how do you help people get through when they're not going to reinforce something, not ending up where you have to reinforce because now it's gotten completely out of control. Any thoughts about that?
Right, absolutely. Yeah. This is something that we have to tell parents at the very beginning when we discuss extinction, when we discuss ignoring, that in many, many cases what's going to happen, the behavior that used to be reinforced and no longer is reinforced, it's going to escalate because the child is like, what just happened? You know, I used to be reinforced for that with attention or whatever, you know, getting whatever I want, and all of a sudden, nothing. So I need to do more of it. I need to make it even worse. I need to increase the duration. And then parent needs to be prepared to what to do with this. So you do a lot of coping ahead with the parent, and you have to make them understand that they need to hold on for dear life and not reinforce no matter what. Otherwise, they are, remember how we talked about turn pain into suffering? So right now they're in pain, then it's going to be suffering. And you need to have them understand this, and you need to have them cope ahead what they're going to do if this is to happen. The other thing I tell them that sometimes you need to make sure that child will be safe and that your property will be safe. You know what, I have parents removing some of the valuables from the house and reinforcing doors because they have to stay, you know, behind that door when child is raging outside. I had one parent who was sleeping on the floor of her other child's bedroom because she would not want to come out because the other child was standing outside and would be, you know, continuing to scream and yell, and mom could not come out because otherwise she would reinforce it. So a lot of things that needs to be considered ahead of time, and this is something that you need to process with the parent. And also the other thing is that I keep telling them, if you're absolutely sure that you cannot withstand this because of whatever it is, then be prepared that, you know, maybe you just need to go around it in a different way. If you have to go somewhere and you have to be somewhere and you cannot just ignore this, you need to figure out what to do with that ahead of time.
My only two other cents about that, in addition to helping the parents fortify themselves, sometimes the spouse or significant other needs to help the other, bite the bullet, self-soothe in the back room behind a locked door during that, is sometimes, you know, soothing, you know, finding an alternative behavior for the child and reinforce some other behavior and soothe them, and let them know this is tough. Like, I know this is hard. I know I'm not giving you what you're asking for. I know this, like, so you can kind of do all that. I don't know if that would fit into her protocol, but in terms of with the adolescents I work with, it's not to say you have to always blatantly ignore any, just saying, I'm going to tell you right now, I'm going to close the door. I know it's going to be hard for you, and kind of validate the kid as you're going through this extinction burst. Yeah.
Right. We know parents say, you know what, I answered this question once, I'm not going to talk about this anymore, and then, you know, not just start ignoring all of a sudden. And usually children understand, you know, after a couple of those things that, you know, what's going on. Right?
There's another question that came in specifically for Allison. Allison, would you care to comment on that before I move on to this, or shall I move to this?
No, you can move on.
I'll move on to this. So first, it's a thank you for sharing, for the trust, for your trust in sharing your personal experience here today. And the question that comes in is if you could comment as someone who's speaking about your experience of having BPD, going through that kind of treatment, whether hearing researchers and clinicians speak about these issues and borderline personality disorder feels invalidating, or is it a positive experience, interesting, validating, anything like that?
I would say that it's probably a little bit of both.
And it does say a more open. Do you have impressions that you're comfortable sharing about again being hearing the other speakers today?
Just that I'm really happy to be here and to learn something from everyone that presents.
Okay, thank you. All right, we have a question here. We've got more DBT questions in here. This one is about situations where you're treating the kids, perhaps, but then you observe that there's BPD in the parents. When do you diagnose a parent, when you're treating the child, or any other comments about this kind of issue? If you have an identified child, but then you observe BPD in the parent.
I don't know if I would make a diagnosis of the parent, but I certainly would be comfortable talking about by dint of the fact that we have them in our multifamily group, and they, every 5 or 6 weeks, we go over the 5 problem areas that relate not only to the teenager, but to each parent, that they're self-endorsing, I'm having trouble with my anger, I'm having trouble with relationships, I'm having trouble with my, impulses. So they're kind of self-disclosing without my prompting necessarily, what they're struggling with and what help they need. And if through this multifamily skills group, where they're presumably acquiring skills, practicing skills, strengthening skills, generalizing skills, if that's not getting any bang for its buck, and we have some family sessions, I might make a private recommendation to consider their own personal therapy, either during or after that, to make sure we help them, reach their goals as it relates to personally as well as to their children.
Thank you. There are some, this next one is, are there or could there be DBT-trained crisis call centers or after-hours coaches? And then it goes on, for when a therapist, primary coach may not be available. So coaching not by the therapist.
Certainly in the schools that we're consulting to now, we have the primary clinician, if you will, but then there's special ed teachers, guidance counselors who've also come to our trainings, and they're serving as kind of milieu coaches. So when the primary therapist is otherwise occupied, and we don't want to interrupt their sessions because something is of higher urgency, we train the kids, school kids, to go to another one of their identified DBT team members to get some coaching as needed. So we absolutely do that, and certainly there's other settings too, even an outpatient where we might have somebody on call covering for them. There's some places that around the country that I know actually rotate call. I don't know if that works as well. I think that's another empirical question. My bias is that if you're my client, you're more likely to call me as opposed to some stranger who you don't know, but I'd be open to anybody's thoughts on the matter because I don't know if that's necessarily true.
And the question was about anybody calling specific crisis lines?
It was about having, are there DBT-trained crisis call centers or after-hours coaches? Like, is there availability
so
specifically?
Can call, not just clients who are within the
possibly.
DBT. Right.
Possibly.
Right. I don't think it's going to hurt. I'm not sure if coaching can be readily available because in order to coach, you need to first teach. And how are you going to coach somebody who never, learned how to do it? So it's not going to hurt in terms of the crisis counselor being able to validate and accept and maybe provide some suggestions. I don't know, grab a piece of ice, do pace breathing, whatever it may be. Whether or not the client will be able to understand and appreciate and actually do it, that would be a different question.
That would be a challenge.
Without the training behind it, right.
There's a specific question about, are there DBT materials printed in Spanish?
There are. We've translated and back translated the older version of our adolescent skills manual. So my colleague Miguelina Herman did the translation, and we have someone back translate it. So if somebody would like a copy of that, you can email me, and we will get that to you.
Those are the questions we have. I want to extend a thank you to our speakers for generously donating their time, to all of our volunteers, all of the many people who've been involved, my co-directors, the various sponsors, and all the people who have supported the co-providers. So thank you very much.
And thank you, Seth.
Thank you.
Thank you, Alec. Have a wonderful weekend.